humbled to be here. And as you know the drill, I'll do my form of praise, huh? Today I want to go back to 1963 to speak with a certain Dr. Kish and his needles. Take and stay. Best ever injection. But of course, he's a qualified physician. Welcome aboard Ultimate Health on Joy 99.7 FM with me, Nortey by nature. I think it's Friday, 17th of May was World Hypertension Day. And we want you to know your numbers, know your blood pressure, and learn how to control it. Of course, we wouldn't want you to get hypertension. Don't go there. I think almost 1.3 billion people worldwide have hypertension. About half of them don't even know they have it. And less than half of those who know they have it have being put under treatment and control of their blood pressure. We'll be learning why this phenomenon of high blood pressure is important and of concern, why it's called a silent killer. I've got an officer and a gentleman in the studio. Wing Commander Dr. Bernard Tobo. The Benjamin. That Bernard is your twin brother, and he's a urologist. So I've got Dr. Benjamin Tobo in the studio with me. Yeah, they're twins, and they're all doing great business. And he's with the with the 37 Military Hospital. He's an examiner of I love reading this because it always excites me. So Wing Commander Dr. Benjamin Tobo is a physician specialist with the 37 Military Hospital. He's a fellow in cardiology training or cardiology fellow in training and military air crew medical examiner extraordinaire. Doc, you're welcome.
Thank you very much.
I always switch you and your twin brother. Both of you who have graced our studio, you're most welcome.
Thank you.
Great to have you. We had you up last year around this time, right? Yeah. Great to have you. Have I changed any of your designations?
No.
So you're still a cardiology fellow in training.
Yes.
Okay. Right. And you're still a medical air crew examiner.
Yeah, basically I'm an aviation medical examiner.
Just share that with my listeners before we get into the hypertension stuff.
Well, we examine people who have certain conditions to determine their fitness to fly.
Okay.
And then we also do certification of pilots and other air crew.
Okay.
To determine whether they can work optimally in the aviation or aerospace environment, because it's not a very friendly environment.
Okay.
But for pressurized air cabins, it becomes hazardous to go up there in the air.
Right. Because your workspace has its own conditions, right? And apart from general health and wellness, your health status should indicate and should be used to predict whether you can work comfortably in that environment.
Exactly.
So that's what you do. So you can prevent the crew, any member, from flying.
Yes, once you are not fit to fly, either as part of the crew or as a passenger, you are grounded until you are fit to fly.
Grounded. Okay. Right, great stuff. That's my guest in the studio, Wing Commander Doctor. So you're a physician specialist.
Yes.
Right? And then because you work or function in the military or the forces, it means you also entered the military and you have a rank, or?
Yes, I was a doctor first before joining the military.
All right. I love those uniforms, honestly. I love them. All right. Anyway, you're welcome to the business of today.
Thank you.
Yeah, World Hypertension Day. We try to raise awareness, bring to the forefront the silent killer, break the silence, so to speak. All right. What's the thrust for this year?
Well, the thrust for this year is basically creating a lot of the awareness, because we realize that the awareness level is still low. You know, at 33% or 1/3 of Ghanaians have hypertension.
Right.
And yet half of that number are even aware, are not aware that they have it, and only half do. And of those half that do, a small percentage, about 16 to about 26% are actually on treatment.
On treatment.
And those that are on treatment, a smaller percentage have actually hit the target of controlling their blood pressure.
Wow.
So the awareness creation is huge for this year.
Right. For somebody who sat here in this studio or at Joy FM doing this kind of education year in, year out, past 20 years, when I hear that we still are not hitting the target for awareness alone, let alone diagnosis, treatment, and compliance with treatment, then that's scary.
It is.
Right? We hear of people having strokes. We hear of many cardiovascular-related deaths or mortality and so on and so forth. And still, we're not hitting awareness.
Not at all.
Whoa. Okay. So, about 1/3 of the Ghanaian population is hypertensive.
Oh, yes. Between the ages of 30 and 70 are hypertensive. And
so how
that is scary.
Right, scary, but how can such scary statistics be silent as well? When we say the silent killer, I mean, is it that people are not sharing? And I know we'll come to that because family history is also a critical indicator.
Oh yes.
So, what are people not telling their families? Do the families not know? Do they hide their medication? What's causing this disturbance in awareness creation?
Well, unfortunately or sadly, hypertension doesn't come with any specific symptoms until damage has already been done to organs that are most vulnerable.
Okay.
And because of that, there are many people walking around. And also, coupled with the fact that Ghanaians have a bad health-seeking behavior, we
Right.
don't even do annual medical checks. We wait till something crops up. And when it crops up, we don't go to the hospital. We try the local pharmacy, you
Right.
know. And so all these are culminating in a series of events that ultimately lead to the person showing up only after damage is done.
Right.
You know.
Okay. How does this split, or what does the pink sheet tell us when it comes to male versus female in terms of the prevalence? Is it more men? Is it more women? What does it look like?
It's more men than women,
Right.
until after menopause, and then it tends to kind of like equalize.
Right.
So premenopausal women have a bit of protection, but it's short-lived.
Okay. All right, 15 minutes past the hour of 2 on Joy 99.7 FM. The program is Ultimate Health, your ultimate guide to healthy living. Listen every Sunday, 2:05. We are indeed alive with everything that impacts, concerns, compromises, promotes, facilitates your health and well-being. We will talk about it, and we'll bring in the practitioners and the professionals. Today, I'm talking to Wing Commander Dr. Benjamin Tobo. He's with the military hospital. He's a cardiologist and a fellow in cardiology. And we're talking hypertension. So let's get to serious stuff. You're a cardiologist. That's the heart. But hypertension, let's pretend we don't know what it is, right? What's hypertension and how is it defined and diagnosed?
Well, before we go into the definition, we look at the blood pressure,
Yeah.
which is basically pressure that the blood creates against the blood vessel wall when the
Okay.
heart pumps it.
Yeah.
And when we measure it, we divide the values into a top one and a bottom one.
Okay.
So the top one, which is the systolic, and then the bottom one is the
So in
diastolic.
terms of the figures we see or hear about, so the first or the top figure, which is what now you're talking about.
Yes.
Okay, go ahead.
Now that's the one when the heart pumps
Mm-hmm.
to release the blood out. That's the top figure.
Okay.
And then when the heart relaxes to receive fresh blood to pump out again,
Okay.
the second figure is also measured.
Right.
So we have the diastolic and systolic.
Okay.
And so then there's a cutoff of the value, which is 140 and 90. That's the fence,
Mm-hmm.
which when you cross over to the other side, you are hypertensive.
Okay.
If you touch the fence, you are hypertensive. So
You just need to touch it.
you just need to touch it. 140 or 90. So you can have 120 90 or you can have 140 60. You are hypertensive.
So you need a significant elevation of one of these indices
Yes.
or indicators, right? Or both.
Or both.
So if my systolic is okay and my diastolic is not okay, I am
You-
still
Hypertensive.
right. Now, I'll come back to this again. But, Doc, when we read about it and we're educated about it, we're told on 2 days. Sometimes we hear on 2 occasions or 2 measurements. Can you clarify that for us?
Well, basically, before the measurement is done, you must be optimally relaxed.
Yeah.
You know, quiet. Before the measurement is done, you sit down. Minimal 3 minutes before it is done. After you've come to sit down, feet well positioned, back straight. The measurement machine at the level of the heart,
Okay.
and then we take a minimum of 3 measurements.
Right.
And so the first one usually we discard, and then we take the average of the other 2.
Mm-hmm.
And that is one aspect of the measurement. But sometimes people may come into your office and the environment may be threatening.
Okay.
So that whatever measurement you get, even if for 3 measurements, may not truly reflect the person's blood pressure. probably because of the anxiety of the environment. And
Okay.
it happens a lot in the consulting room,
Right.
where the person comes and the blood pressure goes up. You send him home, he checks the blood pressure in his home environment,
Okay.
and it is okay.
Right.
So because of that, we are careful in diagnosing people with hypertension,
Right.
because we want to optimize the measurement process.
And get a valid measure.
Exactly.
Okay. Now, we used to typically hear 120/80, 120/80, right? And we thought, or we were led to think that, well, when we cross or touch 120, we breach the 120/80, then we are hypertensive, although maybe mildly so. Right now, it seems the 140 is what we hear as the upper limit, beyond which we will be diagnosed as hypertensive.
Hypertension.
Is there any reason for this change, if indeed it is a change? We used to hear 120/80, now we're hearing 140/90.
Well, it's not really a change. It's just a relook at the figures, where 120/80 is still the cutoff for normal.
For normal.
Yes, so that between 120/80 and the 140/90,
Right.
your risk of becoming truly hypertensive starts to increase.
Okay.
And then once you breach the fence, you are hypertensive. So in some jurisdictions, you see the measurements referred to as pre-hypertension.
Pre-hypertension is
Yes.
120 to 140,
Exactly.
and then 80 to 90. Right. Okay.
So
So can you reverse that? You wouldn't want to diagnose anybody in those ranges.
no,
They'd be on caution. Right?
more or less. And so in that state, we don't jump onto drugs,
Okay.
because at the foundation of hypertension control is lifestyle modifications.
Okay.
And in fact, when you aggregate all the core lifestyle modification practices together, they can contribute a significant drop of about 21 millimeters
Right.
of mercury. So if you're overweight, you lose weight. And you are sedentary, you start exercising. If you are in a very stressful situation and you have a way of coping or de-stressing,
Right.
and avoiding a high sodium in your diet. If you're a smoker, you stop. If you drink alcohol heavily, you stop it, or you drop it to moderation. And then you eat what is called a Mediterranean diet, which is basically vegetable rich diet.
Right.
All those things
Low
contribute
fats.
significantly.
Okay.
So someone who is pre-hypertensive, that's what we focus on.
Right.
You do that for about 3 months, and if you win, hooray. If
Okay.
you don't, then drugs come into a
Okie
picture.
dokie. 21 minutes past the hour of 2 on Joy 99.7 FM. Please, those of you sending me messages about Dr. Kish and his needle, please. It was intro. Pay attention in class. Intro, right? But I'm with Dr. Benjamin Tobo, right? He's a cardiologist. We're talking hypertension here. We want to understand what the definition is, what the diagnosis is. And he's just, given a hint that in certain ranges and for certain cases or presentations, your lifestyle modifications, changing certain habits and choices and their consequences can pull you back into safe zones, right? So already we've started hinting certain things, but we'll take our time. Let's ask now. So the pressure within my blood vessels is important, and it can go very high. Indeed, coming up after Ultimate Health is a super clash. Hearts of Oak and Kotoko. Some say Kenke versus Fufu. Whether who will eat what, But it might raise some blood pressures. But from what Doc is telling us, that might not. That incidental, momentary elevation is normal if you are functioning as a human being. Your heart is functioning. That's okay. You're excited. That's okay. But we want to understand this silent killer. Doc, you've mentioned diet and a few other things, but are there risk factors? Let me talk risk factors, and then we'll look at the other things that we tend to call modifiable and non-modifiable.
Yeah.
Risk factors. Who is likely
to
become hypertensive?
Yeah, for the risk factors, those more likely to, we divide them, like you said, into modifiable and non-modifiable.
Yeah.
Those that you cannot do anything about has to do with increasing age. You know, if we have a time machine that we can reverse our age,
Right.
that will help a lot. And there are genetic factors that also come into play. And then some people, hypertension runs in the family. And so once you have those factors at play, and for us black folks,
Right.
you know, we are at higher risk than Caucasians, you know, and so these factors are part of the risk factors, but
Right.
we can do nothing about them.
So I can't change my age. I can't change the fact that I'm black, and so on and so forth. So these weigh in differently,
Yeah,
right, on my vulnerability.
exactly.
Okay.
Then those that you can do something about, those that have to do with like being obese. You can lose weight. If you are diabetic and your sugar control is optimized,
Right.
then you reduce your risk. If you smoke and you stop smoking, then you reduce your risk. If you consume a lot of high sodium in your diet and you minimize it, then you reduce your risk factor. If you eat a lot of junk food and then you cut it out of your diet, you reduce your risk factor. If you don't exercise and mostly sedentary,
Yeah.
that will also help to reduce the risk
These
factor.
are choices you make. These are lifestyle features, characteristics that you can modify.
Exactly.
Right. So your management would focus primarily on getting you to move and shift in the right direction, right? To reduce
To control those ones you can control.
Okay, and you are telling us that about 21 what
21 millimeters.
millimeters in
Because
pressure.
we looked at all these
Yeah.
other lifestyle modifications, and then we looked at the amount of drop in the BP
Right.
that each can contribute. So looking at the lower limits of all of them and aggregate together, that amounts to about 21.
So essentially just modifying these things alone consistently, right? You've dropped your BP by 21 millimeters, which, looking at the seriousness on your face, is significant.
Extremely.
Right.
That's-
Before or without medication
Without
or
medication.
drug intervention.
Exactly.
Wow.
So that's why lifestyle modifications are very core to our management of hypertension.
Okay.
Because we don't like writing medications for patients. So as much as possible, if we can encourage healthy lifestyle,
Right.
then we'll be winning in this drive.
Okay. 26 minutes past the hour of 2 on Joy 99.7 FM. Ultimate Health is the program. And hey, we want you ultimately to be healthy. We're talking hypertension. You hear it all the time. You hear friends say, I've been on hypertensives or antihypertensives for the past 20 years, 15 years. It sounds normal. It is not. All right. It's not supposed to be like that. There is supposed to be pressure within your blood vessels. It's supposed to remain and be retained and restricted within certain limits, beyond which there are problems. I've got the qualified professional in the studio. You are on the right dial. So listen up. We're live on Facebook and YouTube. WhatsApp is 055 11 11 997. And shortly, I will activate the phone line so you get in to give us your confessions, your testimonies, your favorite stubborn academy behaviors, which are also modifiable, the medications you are on, and so on and so forth, and whether the medications affect your in quotes potency in other regards and activities, and therefore your compliance is shaken and rocked by certain things. So when I activate the phone lines, you can do that. But you can do that right now on WhatsApp 055 11 11 997. If you are hypertensive and you are in Kumasi, or you're planning to watch the Hearts versus Kotoko, please listen to us small and advise yourself. Right, Doc. Let me say hello, Oye Inafienya. Yes, what is it about this intro song? I introduce my program with lots of music all the time. Small doctor that I played, Dr. Kish. Yeah, 1963. I'm glad you loved it. Okay, I shouldn't have told them you loved it. Right, that wasn't a complaint. It was, hey, Oye. We've got to meet one of these days. Oh yeah, I met Oye. She was dancing seriously somewhere, and then she came and tapped me. Yeah, so she's physically active. This one says,
That's good.
where is it now? Oh, scroll. Good afternoon, Nortey. Please, I'm listening to the program, but want to know if your guest is the one who was taking part in What Do You Know some years ago. Great topic, Nana. Anytime you come, they ask the what do you know? Confess.
Oh, yes.
Yeah? Yeah,
Yes,
he was
I
a
am.
gem. He was a star. What do you know? How far back was that?
We started in 1986.
All right.
86.
So he knows what he knows. And he's talking to us about hypertension. So he's the one and same person, Dr. Wing Commander Dr. Benjamin Tobo. Right. So coming back, right? So we've got an idea what will make my blood pressure surge upwards. Okay. If it breaches the cutoff we've talked about, then I'm diagnosed as hypertensive. All right. Okay. Why is this critical? And we know there's hypotension, low blood pressure. But why must the pressure within my blood vessels when my heart is pumping and when it relaxes, why is it a critical indicator of health?
Well, the danger that hypertension poses to the body is that as the pressure increases, it transforms the nature of the walls of the blood vessel.
Okay.
It makes it more stiff, and so because it doesn't relax very well, every organ literally is in danger.
Right.
But some are more vulnerable than others. In the heart, when the blood vessel wall is stiff and blood supply to the heart itself starts to suffer, the pump that is generating the pressure is starting to fail.
Right.
And that will be a big problem for the entire system.
Okay.
And then if it happens also in the brain, and it narrows the vessels and causes blood supply to critical parts of the brain to suffer. And then over time, your executive functions also start to suffer. You start having problems. A worst case scenario, when the vessels cannot contain the pressure anymore, they can explode in the vein, in the brain, causing a stroke.
Right.
And that comes with its own problems of morbidity, reduced quality of life, needing to depend on other people, for basic things that you were doing when you felt you were healthy.
Right.
And if it happens to your kidneys, then you run the risk of having permanent kidney damage and being on dialysis. And dialysis is costing minimum 450 cedis per session. And you'll be having about 2 or 3 sessions per week for life.
Wow.
Or until you get a new kidney. And
So
that's not good.
These are possible complications of uncontrolled hypertension.
Exactly.
Right? And there are complications of hypotension as well. Today we're focusing on hypertension.
Yeah.
I have a very stubborn friend. Doc, she just sent me this. I was diagnosed too quickly and placed on BP drugs. With lifestyle changes, can I stop my med? She's always fighting medication. She knows who I'm talking to, right? When my BP drops to normal readings, right? So it's the diagnosis for life. She insists, protests. She was diagnosed too quickly. Side read. Plus, she's very stubborn. So I'm reading it out so that she knows. And if she dares me, I'll call her name. But she's not that compliant. But she's asking a very critical question. If I'm able to, with or without lifestyle modifications, with or without medications, pull my blood pressure to a controlled level within normal limits, do I stop medication?
Stopping, if you want to stop, usually we don't advise stopping. We can have a way of monitoring to see how that BP drop into normal is progressing.
Okay.
In that, for some patients like this, what we do is we ease up on the dosages of the drug by reducing the dose and still encouraging
Doc,
the lifestyle
with your
modification.
permission, you ease up. That is you, the qualified, experienced professional, not them.
Not them.
Not them.
Yes, because you need to be.
Certain people are going to take a cue from this program and say, send me catch you. Anti-me. Please emphasize that again. Who eases up or who monitors the control and takes these decisions?
Is a healthcare professional who does that.
Okay.
And some patients, we've done that and we succeeded. Others, when we eased up, unfortunately, the blood pressure started shooting up again. So that's why it's centered individually on the patient.
Right.
So if you think that your blood pressure has normalized while still on treatment, don't go stopping the medication.
All right. Naki, I hope you have heard. Good afternoon, Nortey. Please, can the doctor tell us the best level of blood pressure? This is Evergreen Linda in Osu. Linda, how be? I mean, normal BP. That's what she means when she says best level. Right? Anything you want to say on that other than the cutoffs we've given?
120/80 is the upper limit for normal.
Okay.
And since it's a pool statistic, that's what is by definition the normal.
All right.
So that you don't want to exceed 120/80.
Because then
preferably should be less than 120/80.
Less than, okay? Right? If you breach it, you are no longer normal.
You are no longer normal.
With regard to
you are now at risk of becoming hypertensive until you cross the 140/90.
At risk.
Then you are hypertensive.
Okay. So you don't want to see those numbers.
No, don't.
Right. What about my stubborn friend's question, which says, well, I've worked back to normal. All right. So if I see normal and I'm supposed to take this medication daily, I've seen normal once or twice, we're out of business. We're done. Oh.
Well, the thing about hypertension medications is that, unfortunately, it's for life. See,
you're such a nice doctor.
You see, hypertension is like a calabash on water. You press it down. You start taking a medication off, calabash starts floating to the surface.
Oh, I love this one.
And so that's the best analogy that I use, so patients don't, start.
So it is down because you've been holding it down.
Exactly.
Right?
With the medication.
So you're not talking cure here, doc. You're talking management.
Control.
Control.
Yes.
Right? And earlier you hinted something which I like, right? And many patients and clients and listeners confuse this. You hinted at targets, right?
Yes.
We've examined you, we've diagnosed, we're treating, but we're treating with targets in mind, right? Based on your presentation.
Exactly.
Your unique individual presentation. You and your physician set a target where you want your hypertension, your blood pressure to be.
Exactly.
Yeah? Okay.
So if you don't hit that target, we haven't won.
So management control has not been successful?
Not at all.
Right.
Until we hit our 120/80 below.
I like this. I will open the phone lines for Stubborn Academy, but some of them are showing on WhatsApp already. Good afternoon, Nortey by nature. I love it when you get it correct. Some write Naughty by nature, and that is naughty. Right. This is very insightful. I'm shocked by the revelation, but what I want to know is breathing difficulties, or is breathing difficulty part of hypotension? Part of hypotension. This is K Danso in Dahwenya. He wants to know if that is associated to hypotension, difficulty breathing. Let me read a couple more. Dede in Maryland. Hey, salute, sister, sweetheart. Ha 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 ha. How can one determine high sodium content in one's food, especially if it's not the person cooking the food? Is it by taste? All right, that's a. They did the atrocity. Chale. You say sodium. Okay, I've heard you. But who measures sodium and how? Right? Hang on to that. So apart from Dede, I've got Kwame who says, good afternoon. Click, 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 click. Right. Please, what causes burst of vessels? Right? That's Kwame. Why would a blood vessel burst or breach? Okay. Charlie, folks are serious here on a Sunday. That's what we do. Nortey, what does this one say? Can the doctor tell us? Okay, that was Linda about normal. We talked about that already. Okay. So Dede is asking about sodium and then this breathing and hypotension. Okay.
Well, for the hypotension, when the blood pressure is low,
Mm-hmm.
one of the ways the body tries to help to normalize it is to try and increase the pressure towards normal. And you find out that it's a combination of blood delivery to the heart
Okay.
and its delivery to the body. And if the delivery to the heart is inadequate, the person starts becoming breathless, takes in deeper breaths to return more blood to the heart.
So compensate, so to speak.
Exactly. So they might find themselves being breathless.
Because you're circulating oxygen around the body as well. Yeah. So if you're not doing that properly,
then that also becomes a problem.
Right.
Then the body starts sending signals to the brain to tell the heart to send more oxygen around. So
pump harder.
Yeah, pump harder. And if the heart is not doing that well, then the person also becomes breathless as part of the signal. It's not only the heart that is triggered to pump harder. The lungs are also triggered to fill the itself with more oxygen much more readily. So in all these kind of scenarios, the person finds himself breathless.
Okay, great. 39 minutes past the hour of 2. Let me quickly announce the phone line. Our phone number 030-221-6541. 030-221-6541. Ultimate Health on Joy 99.7 FM. Nowhere else. We're talking about hypertension. We're breaking it down. We'll talk a bit more about possible telltale signs and symptoms. There was this one about when the vessel is breached or burst, and then today's one about sodium. Can we quickly take them and then try and get back on track? Yeah.
Well, vessels burst because they have become vulnerable.
Okay.
And the blood pressure had increased beyond their capacity to hold that pressure in.
Okay.
And so just like a balloon will burst if you keep inflating it, some vessels that are vulnerable will burst like that, And then for the other one about the sodium. Yeah, usually around like 2.5 grams of sodium a day is recommended in the diet, but
that is when you're putting it into the food.
And some food products come with the sodium level, on them, so that makes it a bit easy
to know how much sodium you're consuming.
Exactly.
But we tend to love our salty foods.
So then you minimize them or you take them in moderation. If you are hypertensive, then you want to make them the exception rather than the rule in your diet.
Right. So what Doc is saying essentially is that taste is one thing, but your taste
can kill
maybe prejudiced or biased. You love the salt, and the salt tells you the food is good and it's tasty, but it could be hurting you, right?
Exactly.
So maybe subjectively you should be pulling back from that level you feel comfortable with. It's a fight. It needs discipline. Right, but we love salty food, and if it's been indicated that as a risk that can be modified, then you start doing your best to modify that. We've explained why a vessel will breach or burst. Right, sometimes there's a what do we call it? A blockage. Right, due to a clot, due to something else, and so on and so forth.
Exactly.
That also increases the pressure. It's just like having the Akosombo Dam and the pressure behind it.
Exactly.
So if it's a weak vessel, then it could also breach. All right. Okie dokie. 42 minutes past the hour on Joy 99.7 FM. The phone line is active 030-221-6541. And I'm in danger of bursting the WhatsApp. Let me try read a couple of these. Good afternoon, Nortey. I'm reading online that it's the kidney that regulates blood pressure. Hence a recommendation one must be made to empty the bladder before checking their BP, right? Please, can you ask Doc to talk about this? This is from Michael in Teshi. The kidney, he reads, regulates or is part of the regulation of blood pressure. And therefore, he's also read about a recommendation or advice that before you check your BP, empty your bladder. Doc, keep that in mind. We'll talk about that in a second. Whoa. This one says, please, the number again. Oh dear, new members, new converts. You want the number again? 030-221-6541. This is the slowest I've ever pronounced it, but I know. Yeah, I'm always looking at the clock and trying to get as much in for you. 030-221-6541. Ultimate Health on Joy 99.7 FM. This one says, Brother Nortey, my BP... Oh no, my BP at times reads 131 over 75. Am I a victim? All right. Modify the words a bit there. 131 over 75. Doc, I don't want to be the one who says it.
You are now at risk of flying towards a hypertensive fence.
Okay.
So we expect it to be below 120/80.
Mm-hmm.
So if you are doing 131/75, it means your risk is increasing.
Mm-hmm.
So someone like this will encourage to maximize or optimize lifestyle modifications.
Okay.
So they don't become hypertensive ultimately.
Okay. This one says, good afternoon, Nortey. I do exercise a lot, and if I check my BP, sometimes it's 116. 120, 112. Do I have a problem? You're only giving me one of the measures.
The
okay.
top values.
Yeah. So you're just giving me your systolic. This is lying, Manprobi. So send the full pink sheet, and then we shall see how we declare the results. I have two callers on my line. Hello, good afternoon.
Good afternoon, Mr.
Hi. Hey, is this Ajiman Joseph?
Yes, I was.
I won't talk to you again. Me and you, we are fine like that. Now you are going to, is it Dubai or South Africa?
Yes, I'm in South Africa.
Hey. Anyway, that means you're a loyal listener. A loyal listener. Eh? What's your question?
Yeah, I have three questions. I want to make it snappy.
No. You like the snappy, but it's never snappy. Go ahead.
The first one seems to be a general question. When I was going to have the quiz, my heart was beating. Though I knew I was going to win, but my heart was beating until I finished. I don't know why. And also, I want to ask, is alcoholism this problem that the doctor is talking about?
Alcoholism related to hypertension?
Yes, I was.
Right. He did mention alcohol use.
Alcoholism and lack of sleep.
Lack of sleep. It looks like you just want to confess. But anyway, all right. So that's Ajiman Joseph going to South Africa. He said before he came for the South Africa quiz, something happened and his heart was beating. Papa Wepa. I have another caller on the line. Hello.
Hello.
Hi. Who am I speaking to?
I'm Akuhe from North Kineshi.
North Kineshi.
Quick question.
Yeah, go ahead.
I'm a diabetic hypertensive for years. Lately, or most times when I check my pressure, the down one is very normal, 80, 79, 82, but the upper one, always high. What could be the problem? Even lately, the doctor increased the medication, add another one to it. But the last time I checked, I even got so discouraged and I'm not even checking anymore. What could be why the upper one is always up, the down one is always correct? Okay. Am I at the risk of anything? And lately too, I was the doctor checked my lab and says, oh, your kidney, the size, everything is fine, but it's running slow, 22%. What could be the problem?
99.7 FM.
Right. Thanks for sharing that. Amoaku in North Kaneshi. High systolic numbers. He says his diastolic is doing great. He's had some additions to his medications, right? Which means he's being seen by a doctor. He's a known hypertensive. He's also diabetic, right? Now he's being told there's deficient functioning of the kidney as well, right? He still has high diastolic, so he meets the criteria for hypertension. It's systolic. Sorry, systolic, right? So hang on to that. There's another caller, then we'll come back and give him some responses. Hello, good afternoon.
Good afternoon, Nortey.
Hi, who am I speaking to? Oh.
Hello.
Who am I speaking to?
This is Hayford calling from Bato.
Hayford from Bato. Please share with us quickly.
Yeah, thanks for your time. I was having something recently in my system. I don't know what is that the sign of hypertension or not. So I just want to share to the doctor to see. Nowadays, when I sit, then from my body to the ground, it's like how the inflate ball. When you are pumping air to ball, it was expansion like that. That's how the system is making me. Anytime I go to jogging and I come back, then I won't feel it. But if I was around, I didn't do any hard work like that, then the whole system will be making that sort of noise to me.
Can you say that again? When you say the system is making noise, you refer to something. Hang on. You refer to something which sounded like swelling, right? But so when you sit down after a while, what are you saying happens?
That I'll be having the same the issue.
It's the issue I'm trying to clarify. What exactly are you experiencing?
Like when I seated for a while, then my body will be making as if they are floating. There's a floating when they are floating a ball. When they are floating a ball, that's how the body will be making it from the waist down to the leg.
Okay. All right. Speak to Abeku offline. He'll try and get some clarity from that. I don't want to distort what you're saying. Doc himself, I can see from the way he's looking at us. Is there another caller? Hello, good afternoon.
Good afternoon, Nortey.
Yeah, who am I speaking to?
My name is Sarah. I'm calling from Adenta.
Sarah from Adenta.
Yes.
Please go ahead.
Okay, so I was diagnosed as being hypertensive a number of years ago. I take Novask, a very small dose. I think that's at least 5 milligrams a day. And I monitor my pressure every morning. Sometimes the readings are so low. I get as low as 110/75 sometimes. So what I started doing was to take the medication as and when the reading is high. On my review, I spoke to the doctor about it. He said no. So we started monitoring it for a month. I took recordings for her. She looked at it, and then now we decided to take it every other day. But still, for instance, this morning when I checked, I got 110/75. But I'm supposed to take the medication today. On days like this, I'm so confused. I don't know if I should take the medication or I shouldn't take it. What should I do?
Okay, thank you, Sarah,
Thank you.
sharing that. We have, oh goodness, another caller, last caller, then we'll come to give responses, which are also part of the program. Hello, good afternoon.
Good afternoon, Nortey.
Hi, who am I speaking to?
It's Echo.
Echo, where are you calling from?
Swedru.
Swedru, you're welcome. Share with us.
Nortey, I'm a diabetic. And I was diagnosed a couple of years ago. I was operating around, I'll say 18 years ago. But I have a BP apparatus with me here. I've been checking it all right. But I've not been able to have the quality sleep. Since 17, 15 years now, I can afford to sleep for 8 hours. I do sleep 2 hours or roughly 3 hours the whole day. So when it's happening this way, when I check it, it's always up. And then but when the weather is cold, and then I'm able to have the normal sleep for at least 3 hours continuously without waking up to urinate. It becomes very normal, 120, sometimes 119, 150. Now where I am able to sleep, and the weather is very hot for me, it might go beyond the 140, sometimes 150, 155. But after I sleep for about 2-3 hours, and then when I check it again, it comes back to normalcy. I don't know what is wrong with the system.
Okay, right. So, Doc, we've got work to do, right? It's almost like an online clinic, but they are sharing things which help us illustrate and explain some of the things. Last caller says he's been diagnosed. He's a diabetic. He seems also to have quite, should I say, some concern, which has led to checking blood pressure regularly. He did not mention, maybe I'm wrong, I didn't listen well, that he was hypertensive. But again, he says that sleep difficulties impact on his blood pressure. and he's wondering, okay, when he feels he's slept well, I see a note that he refers more to sleep duration. He sees duration as quality, but that's a whole program I'll bring on board for my listeners. So that's his one. Then Sarah says that she gets low readings, she gets worried, and now the revised targets and management from her provider suggests that she takes it in alternate days, every other day. And she's still getting the low figures, and she's scheduled to take it today, but she's wondering why. If it's going to bring it lower, I'm confused. Should I take it? Right? And then we had Amuaku, who is diabetic and hypertensive, and his systolic is always high, and he's wondering what's going on. Can we try and answer those, and then I'll try and clean up on WhatsApp before we wrap up.
Okay. Well, sleep is critical to maintaining a good blood pressure also. So if the quality and the duration are good, then your blood pressure or smiles for it. So he at least he's been able to find out that sleep, when he's gotten a much better quality of sleep in terms of the duration, since he did tell us about the other aspects of it.
Right.
His blood pressure responds positively. So what I'll say is to encourage him to invest in good quality sleep.
Okay.
You know, so that
he did also hint that if he sleeps well and he hasn't gotten up to
pee,
that could also be an indicator we should be looking at.
Exactly.
Right? If he's getting up frequently to pee, he's a known diabetic. Right.
Exactly. So his sugar control probably has to be optimized also, because the excess sugar is what spills over into the urine, and then it messes up your nights.
Okay.
Because you have to get up to pee.
Right.
You know. Then the low dose Novask option for her, you know, hypertension medication are taken based on a dose regimen so that it increases to a certain level within the blood. So once you start messing with the doses, then you start affecting the level of the drug in the system. So on days that she thinks that she hasn't taken the medication but her blood pressure is already optimized, is because what is in her bloodstream is doing the work of controlling the blood pressure. Hence
the decision of her provider to ask her to take it on alternate days?
Sometimes we do for certain patients. You know, in other situations we rather half the dose, so that instead of taking standard dose alternate daily, we rather half the dose, then you continue daily like that.
So if this has been agreed and discussed with her provider, what I guess she wants to know is, should she stick with that?
Well, so long as that's a plan that she's already had with the provider, then she sticks with that. If she wants any alteration to that, or she wants to make a suggestion, she discusses with the doctor, and then they can fashion a way out of that.
All right. With Ajiman Joseph, well, his
the systolic hypertension.
No, he's the one who's going to essay, and he came in for a quiz in the studio. He said his BP went up or something. That is related to an event. That's situational.
Exactly.
He wanted to ask about sleep. You just talked about sleep. And then he asked again about alcohol and hypertension.
Alcohol is toxic to the heart. And so once it starts damaging the heart, it will put you at risk of developing hypertension.
Okay. Right. This one says, let me quickly try to clear up on WhatsApp before I hand over to the sports guys. Good afternoon, Ultimate Health. How is eating late related to hypertension? When should we take our evening food before going to bed? What about the size of the food? This is from Kwesi in Kaswa. I like these screensaver confessions. They come as questions, but all the same. We'll try and relate to them. Let me read a few more, Doc, and see if we can wrap up. Please, does BP have any bearing on age or a person's age? Doc had mentioned that as you grow older, you're more vulnerable or susceptible. This is from Ambonsang Bechele, residential area near Michelle Camp. Where's the other one? All right. Please don't forget this. Okay, what is it I'm in danger of forgetting? I read online kidney regulates blood pressure, and that was a question.
Yes.
So emptying your bladder before you check your BP.
Exactly.
What do you say to that, doc?
Well, you don't want to do anything on a full bladder.
Okay.
The whole BP checking process is to make sure you are most relaxed. So having a full bladder whilst your BP is being checked, you will be anxious, and that will confound the BP reading and give us wrong readings. So you don't want a full bladder whilst your BP is being checked.
Okay.
As to the kidney controlling the blood pressure, that is a whole,
more complex,
detailed.
More detailed.
Exactly.
Right? Shouldn't be simplified. That's what Doc is saying, so that we understand, right, the relationship between kidney or renal functioning and your blood pressure. Right. Great stuff. Who is this asking me which station is showing the match? I beg you, if you don't come and whisper in my ear before some people's BP breaches a certain level. Doc, we know there's pregnancy-induced hypertension or gestational hypertension and all of those things. Are they hypertension per se or classically, or do they go away?
They are hypertension. By definition, they are. And for a lot of them, the delivery of the baby tends to, bring the blood pressure back towards normal. But many of them have been found to ultimately develop hypertension later on in life after delivery.
Okay.
So once you have had pregnancy-induced hypertension, you start monitoring yourself for the possible risk of developing hypertension in the future.
It's relevant, or
it is.
It's medical history.
Oh, yes.
That needs to be taken into consideration. Okay. Nortey, for the past few months, anytime I take my blood pressure measurements, I get 120/90 or 118/95. In the past, the down one used to be 80/83 in range. Why is the diastolic one going up, but the other, which is the systolic, not going up? Philip in Sakumono.
Well, you have to look at the various lifestyle factors.
Yeah.
Is there any introduction into the lifestyle that is putting him or him at risk or not? You look at family history, whether he's sedentary, is he exercising, is he increasing the salt intake?
All right.
All that.
So are you conducting the orchestra well? Or are you just playing one instrument, focusing, emphasizing only on your medication? Maybe you've been asked to make certain changes in diet and this and that, and that's what Doc is saying. Check all of them.
Exactly.
Something else could be impacting on your numbers. Okay? So this one says, my in Teshi, my. Can some foods interact with BP drugs?
Oh, yes, some foods can do that. So when you find yourself, the interactions, it depends on the type of food. Some foods can positively interact with the drugs to help drop the BP. Like the dark chocolate cocoa.
Right.
Those types of foods are more helpful to the blood pressure.
Okay.
And then there are others too that are high energy and high octane type of foods that are supposed to push you into high energy levels.
Right.
These energy drinks and the
so
like.
If it's not indicated or not good or doesn't interact well, then it's
you avoid it.
You avoid it, and you should be told.
Exactly.
Right. Okay. Right. We've crossed the 3 o'clock barrier, so we are in high pressure because there's a match, Hearts versus Kotoko. But let me just quickly read this because I'll probably have to grab Doc next week if I can. It says Doc didn't mention the pulse reading which comes along with the BP reading. What is the relation to the blood pressure reading? This is, you see our pulse right down there, and then of course we have these two. Is there a quick answer you can give to that?
Oh yeah, it's a mathematical relationship. Blood pressure equals cardiac output times peripheral resistance, and then the cardiac output is a product of the pulse rate and then the stroke volume. So ultimately, blood pressure equals pulse rates times stroke volumes times total peripheral resistance.
Then you ask for it, meaning it has a relationship or a bearing on your heart's functioning, and that will also bear on the indicators you are getting diastolic, systolic, right? So yes, he gave, what's the formula again? Now you're sounding like you're doing what do you know? Give us the formula again.
Blood pressure is a product of the pulse rate, then the stroke volume, which is the volume of blood per beat of the heart, and then the total resistance
and the beat
to
of the
flow.
heart is the pulse, right?
Yes, exactly. So the number of pulses in a minute it defines the cardiac output, and then we multiply that by the resistance to flow.
Thank you, Doc. Look, folks, don't try my guests. So we don't select them by height. As a friend will say, we don't select them by height. But we appreciate your questions, and we always get a measure. Abeko and I have a pulse on the WhatsApp and the questions, and we know what to bring back and what to repeat and so on and so forth. We'll try and get Doc and some of his colleagues back next week. We'll look at all these measurements, and then the theme was know your blood pressure and then control it. Right? We'll be getting more into the control aspect of it, compliance, lifestyle, and other things. It's not just medications, and your doctor is not just in a hurry, trigger happy to give you medications. Many other factors and variables go into that. Many thanks to my discerning listeners, to my producer, Abeku San Kofi. We take an advert, and I think after that, the sports guys come in with the Kenke versus Fufu, the Kotoko and Hearts match. They can stay on Joy 99.7 FM. My name is Nortey by nature. I'm out.